Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about cleft lip and palate. Let's start. So today I'm going to be talking about a very important topic, especially for parents and parents-to-be, because cleft lip and palate is something that is not only just an aesthetic concern for children, it is also a functional concern for children and their parents. Now, cleft lip and palate, let me tell you how about the normal lip and palate anatomy. This is your upper lip and this is your palate inside. In utero, that means when you are in your mother's womb, during 4th and 6th week of pregnancy, there are two processes. Processes means these are bony processes that basically fuse together. You have the frontonasal process and the maxillary process, and they fuse together. Now, in order for a normal child to have normal features, these processes need to fuse properly. However, sometimes for whatever reasons, these processes fail to fuse normally and there might be incomplete fusion, leading to either isolated cleft lip or isolated cleft palate, or just combined cleft lip and cleft palate pathology. Now, when we talk about the incidence about it, it's considered over 1000 live births as what two incidences. Let's talk about the causes. You have genetic causes, that means you have around 300 to 400 genetical syndromes that are associated with cleft lip and palate incidences, and you have non-genetic causes that could be environmental factors or idiopathic factors, which are related to obviously some sort of gene changes that happen because of the environmental changes that might be happening during the pregnancy time of the mother, such as alcohol, cigarette smoking, stress, any exposure to harmful chemicals, any teratogenic medicines that the mother might be taking while she is in her pregnancy or gestation period. Now, you have to understand the incidences of the percentages of these cleft and palate pathologies is basically, if you have isolated cleft lip, that's about 15%, isolated cleft palate is about 40%, and cleft lip and cleft palate combined is 45%, and you have a lot of other variations for it. That's a completely different thing. You find some features that are there in these children with dental problems such as microdontia, neonatal teeth, that means teeth that are present at birth, natal teeth that are present around the gestation time. You have taurodontism, that means the teeth look like bull teeth, and you have delayed tooth eruption, delayed tooth maturation, and enamel hypoplasia or dental hypoplasia as well in such teeth. The biggest concern for parents is obviously, the first thing is the aesthetics, because it does not look very aesthetic in terms of the societal standards. Secondly, there might be functional problems because of the fact that you require a positive pressure that needs to be created for the infant to suckle onto the mother's breast for the expulsion of milk, and so that the ingestion of the milk can happen, because in nursing mothers, obviously the first few months are the only food that the child takes is actually that of the mother's milk, and that requires a positive pressure to be created with the help of the closing of the lips and the closure of the palate, which should be present at birth to form a positive seal, and thereby the milk can be expulsed and then it can be taken up into the throat and then swallowed. Now, once this happens, because of the fact that if there is some sort of a partial or a complete cleft lip and palate, the positive pressure seal cannot happen, and the milk might just go up regurgitated into nasal floor, and it can cause various other problems. Other problems, such as once the child grows up, he or she can have any sort of otitis media or risk of ear infections. On top of that, speech impediments around the syllables stir, d, p, k, g, all these things. You have to understand that this is definitely a problem, along with speech difficulties, mastication difficulties, tooth problems, hearing problems, and all those things. And the main concern, which is the aesthetic concern, which is one of the biggest things for parents, because they feel that the child is not aesthetic enough as per societal standards. The worrisome thing is not so much, it would have been about 40-50 years back, because the surgical team was just focusing around the functional and the not so much on the aesthetics and not so much on the rehabilitative aspect. But in 2023, it requires a multidisciplinary team for a cleft lip and palate repair to happen, not only just surgically, but in terms of rehabilitation, in terms of psychology, in terms of ENT, in terms of plastics, in terms of speech therapy. So the kids of today unfortunately might be born with cleft lip or palate, but this can be repaired and the child can lead a normal, aesthetic, societally acceptable, functional life with no problems ahead. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. Kindly refrain from calling directly as I might be busy with patients. If you want to get in touch with me, please drop me a message with your name, your location, and whatever common oral health problem that is bothering you, and I'll get back to you within a couple of days. If you have any queries, apprehensions, doubts, or insights, kindly feel free to put them in the YouTube comment section. So that's it for today. Thank you.